As we grow older, we often expect our legs to slow down. Maybe they feel a little heavier than they used to, a bit weaker when we stand, or less steady when we walk. We chalk it up to aging, and while that's partly true, what if there's more to the story? What if your legs aren't just getting older? They're missing something vital. In today's video, we'll explore what really happens to your legs when your body lacks certain essential vitamins, and how these quiet deficiencies may be affecting your strength balance and overall mobility. Vitamins aren't just about general wellness. They play a direct role in how your muscles move, how your joints feel, how your nerves function, and even how your blood flows to your feet. From painful cramps and numbness to slow healing and shaky steps, many of the symptoms we think are normal could actually be your body's way of calling for help. But here's the good news. It's never too late to make a change. Once you understand the signs, you can begin supporting your legs in ways that truly matter, so you can move with strength, confidence, and ease. If this message resonates with you, please like this video, subscribe to Senior Wellness, and share it with someone you care about. Let's take the first step together towards stronger, steadier legs and a healthier you. Muscle weakness and loss of strength. When you lack vitamin D and B12. As we get older, it's natural to feel our bodies slowing down. But if your legs have been feeling unusually weak, if standing up from a chair feels harder than it used to, or walking across the room leaves you more tired than expected, it may not just be aging. It could be a sign that your body is missing something essential. Two of the most important vitamins for leg strength and muscle function are vitamin D and vitamin B12. These nutrients often go unnoticed, but when they're missing, the effects can be felt right in your legs every time you stand, walk, or climb the stairs. Let's start with vitamin D, known as the sunshine vitamin. Vitamin D helps your body absorb calcium, maintain bone strength, and support muscle health. But it does more than that. It also plays a direct role in how your muscles contract and support your movements. Without enough vitamin D, muscles, especially in the thighs and calves, can begin to feel weaker. Everyday activities like standing from a seated position or walking up a short incline can suddenly feel like uphill battles. Many seniors are low in vitamin D without even knowing it. As we age, our skin becomes less efficient at producing vitamin D from sunlight. On top of that, we may spend more time indoors or cover up when outside. Over time, this slow and quiet deficiency can lead to muscle weakness, fatigue, and a loss of confidence in your steps. Then there's vitamin B12. This vitamin supports the nervous system, and it plays a critical role in how your brain communicates with your body, especially your legs and feet. A deficiency in B12 can cause numbness, tingling, and even balance issues. You might feel a strange heaviness in your legs, or a delay between thinking about moving and actually doing it. In some cases, people report feeling as if their legs are asleep even when they've been active. B12 deficiency is especially common in older adults because over time the stomach produces less of the acid needed to absorb it properly. If left unaddressed, this can gradually impair muscle coordination and lead to a greater risk of falls, something no senior wants to experience. Take George, for example. At 76, he began noticing he couldn't stand for long periods without his legs shaking. He also started feeling wobbly on stairs. At first, he assumed it was just his age, but after a simple blood test revealed low levels of both vitamin D and B12. He worked with his doctor on a plan to restore balance. Within weeks, he noticed a significant difference. His strength improved, and so did his confidence. The good news is, once you identify a deficiency, the path forward becomes clear. With the right guidance, whether through food supplements or lifestyle changes, many people regain lost strength and feel more steady on their feet. Here are a few senior health tips to consider. Spend safe time outdoors to help your body naturally produce vitamin D, or ask your doctor if a supplement is right for you. Include vitamin D-rich foods, like fortified dairy eggs and salmon in your meals. For B12, try foods like lean meats, fish eggs, or fortified cereals. If absorption is an issue, your doctor may suggest B12 in sublingual or injection form. Always consult with a healthcare professional before making supplement changes. At Senior Wellness, we believe in empowering you with information, not fear. Muscle weakness in your legs may feel discouraging, but often it's not a permanent decline. It's a signal your body is asking for a little extra support. So listen to those signs, trust your instincts, and know that your strength isn't gone. It's just waiting to be rebuilt, step by step. Cold or numb legs. When circulation suffers from low vitamin E and magnesium. Have you ever noticed your legs feeling unusually cold even when the room is warm? Or perhaps there's a tingling sensation like tiny pins and needles, or a numbness that makes your steps feel uncertain. These symptoms are more than just inconvenient. They may be signs that your body is missing something important. As we age, circulation becomes a vital part of maintaining healthy legs, and two nutrients, vitamin E and magnesium, play an often overlooked role in how blood flows and how nerves function throughout the lower body. Let's begin with vitamin E, known primarily for its antioxidant properties. Vitamin E also helps maintain the flexibility of blood vessels, which is essential for proper circulation. When vitamin E levels are low, blood may not flow as efficiently, especially to the extremities, like your hands and feet, the result. Legs that feel cold to the touch, especially in the lower calves and toes. Poor circulation can also lead to a feeling of heaviness or fatigue in the legs. You might notice you tire faster when walking or standing. Some people even describe it as if their legs just don't want to move. These subtle signals are the body's quiet way of saying, I need support. Then there's magnesium. This essential mineral affects more than 300 functions in the body, including nerve signaling and muscle relaxation. Without enough magnesium, nerve signals may misfire, leading to that familiar tingling or numb sensation in the legs and feet. Over time, this can affect balance, coordination, and even confidence in walking, especially on uneven surfaces or stairs. Magnesium also helps keep blood vessels relaxed, allowing for smooth blood flow. When magnesium is lacking, vessels may constrict more easily, reducing circulation and increasing the risk of cramps or nighttime leg discomfort. Take Clara, for example. At 74, she began waking up at night with cold, tingling feet. She layered socks, adjusted her blankets, and even changed her mattress, thinking it might be a comfort issue, but nothing worked. After consulting with her doctor and reviewing her diet, she realized her meals were low in magnesium and vitamin E. With small adjustments, adding leafy greens, nuts, and seeds, she started to feel a noticeable difference. Within weeks, her sleep improved and her legs felt warm again. That's the beauty of holistic health. Sometimes small, mindful changes make a big impact. Here are a few gentle suggestions that may help support circulation and nerve comfort in your legs. Include magnesium-rich foods like leafy greens, almonds, pumpkin seeds, and whole grains in your meals. Add natural sources of vitamin E such as sunflower seeds, spinach, avocados, and olive oil. Keep moving. Light walking or gentle leg stretches throughout the day encourage healthy blood flow. Listen to your body. If your legs frequently feel cold, numb, or unusually tired, don't brush it off. Pay attention. From a senior living perspective, staying warm, steady, and mobile means protecting not only your muscles and bones, but also your circulation and nerve health. Of course, symptoms like numbness or persistent coldness should always be discussed with your doctor. They may indicate something as simple as a vitamin deficiency or something that needs deeper evaluation. Either way, you deserve to feel comfortable and confident in your steps. At this stage in life, every day is a chance to care for your body with kindness and awareness. Sometimes that care looks like a meal rich in magnesium. Sometimes it's a short walk in the morning sun. And sometimes it's asking what's really going on beneath the surface. Here in the senior wellness community, we believe that aging with grace means staying informed, staying curious, and most of all, staying connected to how your body speaks to you. You don't need perfect health to live well. You just need the wisdom to respond when your body whispers for help. Joint pain and stiffness. The hidden impact of low vitamin C and K2. If your knees feel stiff in the morning or your hips ache every time you stand up, you're not alone. Joint pain and stiffness are some of the most common complaints among older adults. And while we often blame it on just getting older, there's more to the story. One of the less obvious causes of joint discomfort may be a lack of two essential vitamins, vitamin C and vitamin K2. These nutrients quietly support joint health in ways that are easy to overlook until they're missing. Let's begin with vitamin C. Most people know it for its role in immune function, but it also plays a vital part in producing collagen, a protein that forms the building blocks of cartilage, tendons, and ligaments. When vitamin C levels are low, the body can't repair or maintain joint tissue as effectively. This can lead to stiffness, slower recovery after movement, and a general feeling of wear and tear in the knees, hips, and ankles. In addition, vitamin C is a powerful antioxidant. It helps protect your joints from damage caused by free radicals, which tend to increase with age and inflammation. Without enough vitamin C, even mild joint stress can begin to feel more painful than it should. Then there's vitamin K2, a lesser-known nutrient with a powerful role in bone and joint support. K2 helps direct calcium into your bones, where it belongs, and keeps it from settling in soft tissues, like cartilage or arteries. Without enough K2, calcium can start building up in places it shouldn't, contributing to stiffness and joint calcification over time. This is especially important for older adults who take calcium supplements. Without adequate K2, that calcium might not reach your bones effectively, Instead, it could accumulate in the joints and lead to discomfort or reduced mobility. Mary, age 71, had been experiencing stiff knees and tight hips for years. She assumed it was arthritis. But after meeting with a dietitian, she discovered her meals were low in both vitamin C and K2. She began adding foods like bell peppers, citrus fruits, and leafy greens to boost her vitamin C. For K2, she included small portions of fermented foods like natto and soft cheeses. Over time, her joints felt looser, her mornings became easier, and her walks more enjoyable. You may not need dramatic changes to find relief, just a few mindful adjustments. Here are a few senior health tips that may support joint comfort and mobility. Add vitamin C-rich foods to your meals. Citrus fruits, strawberries, red peppers, and broccoli are all excellent choices. For vitamin K2, try fermented foods, hard cheeses, egg yolks, and grass-fed dairy. Combine calcium and K2 wisely, so calcium supports your bones without burdening your joints. Stay gently active. Movement helps maintain joint lubrication and flexibility. Pay attention to signs if you're feeling tighter, slower, or stiffer than usual. Your body may be telling you something important. Supporting your joints through nutrition is a gentle, proactive way to improve comfort and preserve mobility. And in this season of life, mobility is freedom. Freedom to walk to garden, to play with your grandchildren, and to enjoy your day without pain holding you back. Many people believe that joint pain is just something they have to live with. But sometimes with the right nutrients and small lifestyle changes, your body can surprise you. It's never too late to give your joints the support they need. This is the kind of insight we value in Senior Wisdom, listening to what your body needs, adjusting with grace, and continuing to care for yourself in ways that bring strength and ease. And as always, if you're experiencing ongoing joint pain or stiffness, it's important to consult your doctor or a licensed healthcare provider. They can help identify the root cause and guide you toward the right support, because you deserve to feel steady, strong, and well. Balance issues and risk of falls. When B12 and vitamin D are too low. Have you ever felt unsteady on your feet for no clear reason? Maybe you've caught yourself reaching for the wall or hesitated before stepping off a curb. For many older adults, these moments of imbalance feel sudden, but they may be signs of something deeper. 2 important nutrients. Vitamin B12 and vitamin D play powerful roles in maintaining balance, strength, and coordination. When either of them is low, it can quietly increase your risk of stumbling or falling. Let's begin with vitamin B12. This essential vitamin supports your nervous system, helping your brain send signals throughout your body, especially to your legs and feet. When B12 is lacking, those signals can become delayed or distorted. You might feel tingling in your toes, numbness in your soles, or even a sense that your legs aren't quite under your control. Over time, low B12 can lead to proprioception problems. That's your body's natural ability to sense movement and position. Without this feedback, simple activities like walking in a straight line or climbing stairs can become more difficult. It's not just about feeling weak, it's about feeling disconnected from your own movements. Now consider vitamin D. Best known for its role in bone health, vitamin D also supports the muscles and reflexes that help you catch yourself when you slip or step wrong. When vitamin D is low, muscles can become weaker and reaction time may slow. This combination can make a small misstep turn into a dangerous fall. For seniors, the stakes are high. Falls are one of the leading causes of injury in older adults, and sadly many of those falls could be prevented by addressing underlying nutrient deficiencies. Take Sam, a 75-year-old who had always been active. He began noticing his balance was off. He'd drift slightly when walking, or lose his footing on uneven ground. After a simple blood test, he discovered his B12 and vitamin D levels were both low. With the help of his doctor, he made dietary adjustments and added supplements as needed. Within a few months, his steadiness improved, and so did his peace of mind. Here are a few gentle, practical tips to support your balance through better nutrition. Include vitamin B12-rich foods like eggs, dairy, fish, and fortified cereals. If absorption is an issue, talk to your doctor about sublingual or injectable B12. Get safe, regular sun exposure to help your body produce vitamin D, or include foods like salmon, mushrooms, and fortified milk. If needed, ask your healthcare provider about vitamin D supplements, especially during winter months, or if you spend most of your time indoors. Practice gentle balance exercises like standing on one foot while holding a chair to help retrain your body's reflexes and awareness. Most importantly, listen to your body. Feeling wobbly or disconnected isn't just aging, it may be your body's way of asking for support. From a senior living perspective, independence means being able to move confidently and safely through your day. Whether it's getting out of bed, stepping into the shower, or going for a walk, balance matters and it's worth protecting. Addressing vitamin deficiencies isn't about chasing perfection. It's about taking small steps to feel stronger, more stable, and more in control of your movement. This is the kind of insight that reflects true senior wisdom, recognizing the value of preventive care and making thoughtful adjustments that honor your body's changing needs. And remember, if you're experiencing frequent imbalance, unexplained falls, or changes in how your legs feel, don't wait. Speak with your doctor. A simple test could reveal what your body needs to feel steady and supported again. Your steps matter. So does your safety. And with the right care, you can continue walking forward with confidence. Slow healing and fragile bones. The overlooked role of vitamin C and K2. Have you ever noticed that cuts or bruises take longer to heal than they used to? Or perhaps you've experienced a minor fall that resulted in more damage than expected. These moments are more than just frustrating. They may be signs that your body is quietly missing some important support. Two nutrients in particular. Vitamin C and vitamin K2 play essential roles in how your body heals and how strong your bones remain as you age. When either of these is lacking, the effects can show up in your legs, your balance, and even your overall confidence in moving freely. Let's start with vitamin C. Most people know it for supporting the immune system, but it's also a key player in the healing process. Vitamin C helps the body produce collagen, which is crucial for maintaining the strength and flexibility of your skin, blood vessels, and connective tissue. When levels are low, wounds can take longer to close. Bruises may linger, and the skin on your legs may appear thinner or more fragile. This becomes especially important for older adults who are already more prone to small scrapes or bumps from daily activity. Slow healing isn't just inconvenient, it can increase the risk of infection, limit mobility, and lower your quality of life. Now let's talk about vitamin K2, a lesser-known nutrient that plays a powerful role in bone health. K2 helps guide calcium into your bones and teeth where it's needed most. Without enough K2, calcium can be misdirected into the arteries or soft tissues, reducing bone density and increasing the risk of fractures, even from seemingly minor falls. For seniors, this matters deeply. A broken hip or leg bone can lead to extended recovery time and rehabilitation, and in some cases permanent mobility loss. But when your body has the right tools like vitamin C and K2, it's better equipped to heal, rebuild, and stay resilient. Consider Harold, age 79. After tripping on a rug at home, he suffered a small fracture in his lower leg. His recovery was slow and painful. Later, a nutritionist reviewed his diet and found that it lacked both vitamin C and K2. With guidance, Harold added foods like oranges, red peppers, and leafy greens for vitamin C, and fermented foods like natto and hard cheeses for K2. Over time, his healing process improved, and he felt more confident in his steps. Here are a few senior health tips to support healing and bone strength naturally. Eat vitamin C-rich foods, like citrus fruits, strawberries, bell peppers, and broccoli regularly. For vitamin K2, include fermented foods, egg yolks, hard cheeses, or grass-fed butter in moderation. Pair calcium with K2 to ensure that calcium goes where it's needed into your bones, not your joints or arteries. If you take a calcium supplement, ask your doctor whether adding K2 is appropriate for you. Keep an eye on your body's signals. If bruises linger or cuts heal slowly, it may be time to revisit your nutrient intake. In the world of holistic health, healing isn't just about what you put on a wound, it's also about what you nourish your body with from within. Your bones, your skin, and your entire healing system rely on a foundation of essential nutrients. And the good news is supporting your body in this way doesn't require drastic change. Often it begins with small, thoughtful additions to your meals and daily habits. It's also important to remember slower healing is not just part of aging. Sometimes it's a gentle message from your body asking for a little more support you absolutely deserve. If you've been experiencing slow recovery or worry about bone strength, speak with your healthcare provider. A simple conversation can lead to better strategies for protecting your independence and comfort. Because in the journey of aging well, your ability to heal and to move without fear is one of your greatest gifts. As we close today's video, take a moment to honor your legs, not just as limbs that carry you, but as symbols of strength, independence, and the journey you've walked through life. The truth is your legs don't just grow tired with age, they grow wiser. And when they start to speak through discomfort, weakness, or imbalance, it's not a failure, it's a message. A gentle reminder to pause, listen, and care more intentionally for the body that served you so well. The 6 vitamins we explored today are not about perfection, they're about possibility. The possibility of moving with more ease, standing with more confidence, and living with more freedom. So whether you're just starting to notice changes or have been living with leg discomfort for a while, know this: it's never too late to support your body in new and powerful ways. One small change, one new habit can shift everything. If this video resonated with you, please take a moment to like, subscribe, and share it with someone who might need it today. And don't forget to leave a comment. We'd love to hear your story, your questions, or your words of encouragement for others. Until next time, stay grounded, stay strong, and keep walking forward one mindful step at a time.